We have heard it all. Those old wives' tales about how eating too much sweets will make your child drooly. Don't get me started on not being able to eat beetroot because apparently you will bleed too much during childbirth. Today we're discussing what is myth and what is fact.
Parenting. Let's talk about this.
Being a parent is about godliness.
I
So much of myself through parenting. There is no formula of raising a child.
Hello, this is Pansy on the left.
I think having a good support structure makes it all worth it.
Dumelang Batswadi, my name is Karabo Mutiri and welcome to Ask a Parent, the show about everything parenting. Whether you've wanted to know how to bring sexy back after childbirth or want to understand pre- and postnatal healthcare or even just want to understand the dynamics of child loss, this is the platform for you. Today, we are sitting with our guest midwife, Sister Mbali Ngobo, and our mom guest, Lungile Masirumule and Mpho Mukwena. Welcome, ladies. Yes. So, Lulu, what are the craziest myths that you've heard in your parenting journey?
Craziest. We'll
Yes.
be here for a long time.
We're going there.
I think the one that really affected me is when I was pregnant with my first child, I was told that I mustn't eat a lot of oranges because the child will have jaundice and discoloring.
Whoa.
So that one actually,
Yeah.
my child ended up with jaundice. So
Were you eating the oranges?
Yes, a lot.
But,
A lot.
But Sister Mbali, is there a correlation between the oranges and the jaundice, or is it just an isolated event?
Isolated. There's no relation at all. Jaundice is only caused by the breaking down of red cells. It has no relation to oranges. Take as much vitamin C in that
Yes.
pregnancy.
So what have you heard?
With me, people are not supposed to touch your belly because it will bring misfortune, like a miscarriage. So you can imagine everyone, congratulations. You have to,
No, don't touch.
don't touch. No. So like it was really, I really didn't understand where that came from because I think with our parents, they hear things and then they pass it to you and you have to believe them. So yeah, with me,
It just becomes generational.
Exactly.
Because I didn't like people touching my belly, but I don't think it had anything to do with me thinking. It's just a personal space thing.
Exactly.
Like, why are you touching me?
Half the time you are annoyed, you are irritable, you are hot.
Yes.
Your body is going through the most.
You are going through the most.
Exactly.
Did you like people touching your belly? No.
Oh, I loved it. I liked the attention. I was like,
Come, touch me. So the only crazy one you've heard was the touching the belly thing.
And the other one was you're not supposed to stand by the door or the gate because apparently you're going to have a hard time when you're giving birth. So every time I would forget, like literally people would come visit and then
Yeah.
and then you stand. Your mom would be there by the window. Oscar, don't forget, So
I've actually heard someone saying I should not stand by the gate when I was pregnant. And it was such a shock for me because I was standing by the gate and I got reprimanded like a child. Just move from the gate. You're like, but why? What did I do? I'm just standing by the gate.
Yeah.
actually, talking about tough time when you're giving birth, I heard, Guti, you mustn't have ice. Anything with ice. Ice cream, ice, anything with
Why?
ice. Because the labor ward, you're going to get cold. Okay?
Yeah, or the
and then
baby.
I got to the labor
You are in
ward.
the hospital. It's
Or
cold.
the baby's going to come out shaking. And now you worried, ooh, the baby shaking. So yeah, no.
Usually when you go to theatre, that's when it's cold there, but it has no relation to ice, to have your coffee, have everything, have your ice, do everything. Yes.
Another one I've heard about potentially having a difficult birth is that you can't braid your hair.
Yes.
You're not allowed to braid and dye.
And cut your hair. You can't cut your hair. You can't dye it.
Yeah.
You can't braid. I've also heard that.
Oh my God.
So, Sister Mbali, how often do you hear these myths from your patients?
We actually, it's different now with our generation. Our generation is very informed. They research a lot. So it has died down. Let me just say, for the last decade, it has. Because the information is there now on what's correct and what is wrong. So we don't hear much. Maybe with other races like Muslims, if I'm allowed to mention,
Yes.
they still do stick to some, but with us, no, It's not
gotten much
It's
better.
gotten much better with information that is there.
With the Google generation
Yes,
that just
and
Googles like,
Google.
can I
Yes.
braid my hair? And then Google
braid
is
your
like,
hair.
go ahead.
Yes.
Okay, so access to information has
Information has actually
played a big role in that.
Yes, it has.
Okay. So I think in relation to what also said about what our families believe in, especially with miscarriages and stuff like that, I was instructed clearly not to tell people that I was expecting, because then I run the risk of potentially losing the child. And I've seen that a lot in especially people that have previously lost their children and were very open about it. The next time they fall pregnant, they become, I don't want to call secretive, but very private with their pregnancies, because they're like, okay, maybe I lost the first child because I was just openly telling people about my pregnancy. How dangerous do you think it is to hear stuff like that and believe it?
Miscarriages, usually they're not related to that mostly. First trimester is the most difficult, so that's when they tell you don't tell anyone between 0 to 6 to 13 weeks. Mainly because sometimes implantation, when it has to happen on the womb, sometimes it doesn't get attached correctly, so that you lose baby. And sometimes your lifestyle, sometimes like if you smoke, if you drink a lot, all of those things, they lead to you losing the baby. It has nothing to do with you telling people that you are pregnant. So it's mostly your lifestyle, maybe implantation was wrong on the uterus, that's all.
You know, talking about effects, when my son came out and I was told that he's got jaundice, the nurse, unfortunately, I don't think was as professional, because she said to me, no, we need to treat this because your child is going to be stupid, which is another jaundice myth. And that affected me very emotionally, and you know, it kept on playing on my mind that what if this thing doesn't go away? What's going to happen? You know what I mean? So have you found that it doesn't go away on some children?
Naturally, the body can rid itself of the yellow discoloration of the bilirubin in the system within a few weeks. But then others, you might need treatment like phototherapy, where they put the baby under a light.
That blue light.
That blue light, yes. And then we just increase the fluids, because what we want is to wash out, if I can just say that in the easiest term, to wash out the yellow, the bilirubin in the body. So that's just about it.
Let's talk about sweets and drooling.
It really affected you.
So it's a myth. It's a total myth.
It's a total myth.
Because I think, when my daughter started drooling, people were asking me, were you eating sweets? I was like, yeah. Like, I ate sweets now and again. It's like, yeah, that's why.
No, it's that we usually say babies are glucose dependent little naughty creatures. They thrive on glucose to survive. Sometimes when the baby's not even playing, when we say take a sweet or drink a coke, so if we don't drool afterwards, that we wouldn't suggest something like that if we know it will have effects when the baby is born. So actually glucose is good for them, it wakes them up when they are sleeping.
Yeah, but we would like them to sleep also.
Once they are still in the uterus, because if your baby is not playing nicely, maybe you've been lying down and you feel that you haven't had the movements for the longest time, we suggest you to take a little bit of a sweet. It wakes them up, they love sugar.
So, Sister Mbali, what are some of the fears that exist in terms of, hearing and believing some of the myths that are so prevalent in our society?
Fear is being like failure as a mom. They say these things so much and they work mentally. Said that when something like you, when they said your baby will be stupid, can you imagine? So if maybe you were not young and very informed and you found out yourself what jaundice was, imagine what if you had proceeded from there, you would have thought your baby will continue to be stupid. So the fears are like failure as a mom, for starters, and secondly, you will not raise your baby how you want to raise, because everyone will have will impose on how to raise your own. I always tell my patients, this is your own journey. Before you be informed, factually, you have your nurse, you have your midwife, you've got your gynae, you've got even people who have done it but who have done it the right way. Ask them. Moms then are not the same as now. So we are able to forge our own path, our own way.
Yeah. So it's also, it sounds like it's very important to also decipher what works for you and what doesn't. Because I think I always say our parenting journeys are not the same. You know, what works for you doesn't necessarily work for me.
Even how we labor, we don't, because they'll tell you, maybe you feel contractions. The other one will, the water will break first. They won't feel the pain. So it's different journeys for different.
Can we talk about water breaking myths, please?
Yes.
Can we just address?
Please let's not talk about the movies, because in the movies
It's always breaking.
now.
Hey.
When water breaks, it doesn't necessarily mean that when water breaks, it will be a gush like someone spilled a bucket of water.
Yes.
Sometimes it will be a trickling, like you peed yourself, continuously. It's not stopping. So, and that doesn't necessarily mean that the baby is coming in the next hour. Like we see in the movie,
Yes.
you start to
Just go and
Because that's what happened with me. Like as soon as the water was coming out, it didn't break the way it took like a day and a half, and the water was just going out like, and then I was like, literally after I saw the water coming out, I thought to myself, no, the baby's coming. And then it took like 2 days. I was like, what the hell? What's happening?
But the movie said I should give birth by now.
Exactly.
Because also they make it so dramatic. The screaming and the drum. Yes.
The pain comes out.
You're waiting for the pain, but there's no pain. So yeah,
What I would encourage is when the water, because sometimes other mothers, this is another myth, the old mothers will tell you, when the water, wait for the pain, don't go to hospital. But as long as you see something abnormal, there's a trickling of water, rush, go to hospital. You just need to be monitored regardless.
Yeah. Because I've also heard that there's an increased chance of you getting an infection after the water breaks.
No, I got an infection.
No.
I got an infection with my second one. Because with my first one, I was very relaxed. Because I knew the water breaks, there's no pain, I must just, so I stayed in hospital. Second one, I decided, no, I'm going to do my hair, do my nails, and then we can go to the hospital.
Just go to give birth just looking fly.
Exactly. And I picked up an infection somewhere in all of that. So it's very important, as you say, go straight to the hospital.
Pain doesn't dictate your journey to hospital. But if water comes, go to hospital. Pain, go to hospital. It's the safest.
There's no exaggerating.
Yes.
Better safe than
And myths about labor pains, how they're supposed to come, how they're supposed to feel. Do you get questions like that? For instance, people would exaggerate a lot when it comes to labor pains on TV as
I
well.
wouldn't say they exaggerate. It's tough.
Yeah.
It's rough.
Yeah.
But I personally had a cesarean section, but as a midwife, what I see
see
it's
a lot.
excruciating.
Yeah.
So I don't think every person can come and confirm that much. It must be.
Yeah. No,
It must be really painful.
I definitely understand. I can also agree that we go through the most when we go through labor pains. Yeah, I think the important thing is the fact that we're living in a generation now where we can access information, and when we do hear something like a myth or a fact, we can always just
run to Google.
Just check, is this a fact, is this not? So I think at the end of the day, people just do you.
Yes.
Do you. What works for me doesn't
work for the other
necessarily have
person.
to work for you.
Sure.
Be informed. Information is very, and we're living in an age of information.
Yeah.
So we can't say, "Ish, I wasn't sure." So
Yeah.
I decided. Now you must have nappy hair because they said you mustn't braid your hair. It's like depriving yourself of nice things.
Exactly.
Because of the myths.
And if your hair is braided, when that pain comes, because you do this.
Yes.
At least if it's braided.
Yeah. Ladies, thank you so much for joining us. This was a very informative and fun conversation. To our viewers at home, please comment down below and share with us what your craziest myths that you've heard during your parenting journey were. Thank you so much.